Hello, hi, it's Ariel Ostad. It is such a pleasure to be with you and welcome you to our webinar. I am so excited to be here with you and given our trying times with everything that we're dealing with everything that's going on. I'm just happy to be doing this for you. My intention is to talk to you about non-facial, non-surgical facial rejuvenation. This is something that really interests me, and I'm really excited about the fact that these techniques are available. And my intention is to really inform and educate everybody about what we do in the office. I'm actually here in the office. I'm in my scrubs, something that I missed. We started seeing patients about a couple of weeks ago, treating patients with essential conditions, whether it was skin cancer or patients who've had pre-cancer. So I'm so grateful to be able to be back here, and we are starting to treat patients with cosmetic needs, and so we are here to help and serve you. And with that said, I just want to wish that everyone is doing well, that everyone is safe and healthy, and given everything that our country is dealing with, I hope we overcome this, and I know we will, and I know there are many aspects that's really creating uncertainty for us. And I'm just looking forward to a better and brighter future for all of us, our children. With that said, let's get started. So welcome. I'm so glad to be seeing you, and I want to just go ahead and share my screen with you. Excellent. So the topic is non-surgical facial rejuvenation. And what that means is basically how can we really prevent aging utilizing non-surgical methods. I teach this information as well to NYU residents. These are young doctors at NYU Medical School that are interested. And so I am excited about using my skills and my artistry to help patients look better. Okay, excellent. So what we will be talking about today is really Botox, fillers, and lasers. Botox is a neuromodulator that's derived from a protein. What a neuromodulator basically means is that it's a protein that is able to affect our nerve endings in our skin. And basically, Botox relaxes and prevents the overuse of targeted muscles that create a tired, heavy facial look. As we age, unfortunately, our facial muscles get stronger from just using them, being expressive. And as those muscles get stronger, they pull down on this skin. So basically, they typically result in what we call frown lines, forehead creases, crow's feet from smiling, squinting. So typically, Botox is injected into the forehead to smooth out forehead lines, the glabella, which is the area between the eyebrows that's responsible for frown lines. We inject it into the canthus, which is basically area in the corners of the eyes, the crow's feet area, to smooth that area. We can actually really help you help patients with using Botox in more advanced areas. For patients who suffer from gummy smiles where too much of their gums are shown and smiling, we can actually use it to slim the face. People who basically suffer from a condition called bruxism, where from clenching or anxiety, they have strong muscles. By injecting there, we can actually smooth and narrow the face. And we can actually really help smooth bunny lines. These are, again, from smiling. I'm going to show you some before and after pictures. The patient on the left is somebody who has, and I'm sorry about the noise out there. There's some construction that has been resumed out there, so bear with me, please. So this is an individual on the left who basically has strong, what we call corrugators. These are muscles that are responsible for creating that frown line. And you can see with injecting Botox, you can really create a smooth surface. This individual also had Botox injected into her forehead as well as her crow's feet, and you can kind of just see how the skin just looks smoother. Botox typically lasts for about 4 to 5 months, and the key is to really inject it properly so that you can really rejuvenate the face so that patients don't have that surprised look. Patients look very natural. And that is a philosophy that I share, that less is more. Here's another individual with strong forehead lines. The person on the left is basically lifting up her eyebrows, creating deep furrows on her forehead. And you can see how the forehead just kind of lays much smoother, despite her trying to lift her eyebrows. One of the key things with Botox is that you can't apply a cookbook approach to everyone. And there's really an element of knowing the anatomy and using the artistic skills to just put the proper amount so that you can maximize the benefits in terms of making sure there's longevity, it lasts for the adequate amount of time, and that also it looks right, it looks good, so that patients, for example, don't have too much injected where they can get drooping. Here's somebody with strong crow's feet, and you can see how the area just kind of lays much smoother. This is an example of an individual who, still being beautiful, has kind of a heavier lower cheek because she clenches. And this is the picture on the right, shows her with some Botox injected into what we call the masseter muscle, which is the muscle on the outer edge of your jawline. That muscle is responsible for being sort of creating this bulging look from being overused, from clenching. And we can kind of create a slimmer face. The person on the left, you can see her gums from smiling. And, an ideal feminine smile is where you're not really showing too much of your gums, just a slight millimeter of it. So proper injections into the muscle that's responsible for elevating your upper lip can actually, these are called elevator muscles that are right below the nose, and it's really a drop of Botox in that location can just relax that muscle to the point where you can still continue to smile normally, and yet you can have a beautiful smile and less gums are shown. So that's Botox. Again, Botox is extremely safe. It's been around for about 20 years. There are a variety of different neuromodulators, Botox being the most famous one, being the one that's been around. It has certainly a lot of medical indications. And in my hands, I can really get Botox to last for about 4 to 5 months. And the key is to just do it in a proper way where people have that beautiful arch to their eyebrows, their forehead looks smoother, and yet they're not overdone, so they don't have that frozen look. So moving past Botox, I'd like to talk to you about fillers. Fillers or dermal fillers, dermis really stands for collagen. Fillers are really injected beneath the surface of the skin to add volume and fullness to areas that might have lost volume. As we age, not only we lose collagen in our skin, leading to wrinkles, but we also lose support structures below the collagen layer. And that's kind of the fibro-fatty tissue within our face. And as we age, unfortunately, not only some fat is lost, some of the fat shifts. And as a result, it creates hollowness in our cheekbones. It can create prominent laugh lines, otherwise known as nasolabial folds. It can create prominent marionette lines. Those are lines that emanate from the corners of the mouth down to our chin. Sometimes you don't have to sort of have imperfections just from aging. For example, there are individuals who unfortunately have nose imperfections, and now we can use fillers as a non-surgical way to create a better nose contour, so therefore avoid surgery. We talked about how laugh lines get more prominent with aging, and certainly we can get a sagging jawline from losing some collagen, but more importantly, the fatty tissue kind of moves down from our cheekbones and kind of settles down along the jawline, creating a sagging jawline. It can be used to inject between the eyebrows in people who have very deep lines where Botox is no longer going to work because the lines are really deep. We can just with a few drops of really filler improve the jawline. The eyebrows. We can obviously improve the jawline as well. One of the common areas where fillers are really utilized is under the eyes. We get that hollowness from the fact that we lose collagen. We actually, the fatty tissue starts shifting. So fillers can really be utilized there. And certainly if you wanted to improve the contour or the volume of the lips. I'll show you some before and after pictures. This is just to kind of show you an individual on the left and her post fillers after on the right. Here's somebody who was really in her early 60s, beautiful woman, but yet she felt that she was getting kind of some sagging under her, some hollowness under her eyelids. She was getting some prominent laugh lines. She was getting some hollowness on the outer aspect of her cheeks, and her jawline was falling, creating some jowling. And with some proper filler placement, we can kind of see how, if you follow me on the arrow, how her lower eyelids are improved. Her laugh lines are softer. She has more of a better contour on the outer aspect of her cheeks and her jawline. The key is not to over volumize, not to overfill someone so they don't look awkward. It's about really creating what we call micro optimization, where with just proper amount of filler, we can make somebody look better, where they're not overdone. Here's a younger individual. Here's somebody in her 30s who was unhappy with kind of this tear trough deformity, we call it, which is kind of this crease that very naturally forms as we age. And then she's sort of beginning to see some laugh lines. She's beginning to have some nasal, some marionette lines. Her cheek is kind of flattening, which is causing some little bit of heaviness on the jawline. And with just proper filler placements in the lower eyelids, the cheekbones, a little bit in the laugh lines, we can really create a much better support where she has the right curvature to her cheekbone, her laugh lines are softer, her jawline is lifted, and her lower eyelids look better. And again, the key is to really be able to know the anatomy, knowing where to put, how much to put, and to get that maximum benefit. Here's an individual who basically did not like her lower eyelids. She felt that she looked tired, yet she wasn't. And with just the proper amount of filler, we can actually just create a better lower eyelid structure. Here's another individual where, again, she felt that she had some fullness to her lower eyelid, what we call bags. And with just, this is immediately after, so you can kind of see these little needle marks where the area looks better. Typically, fillers last generally approximately a year and a half. It obviously depends on the type of filler we use. There's some thinner fillers used for fine lines that may last a little less, maybe about a year. And then there are fillers to really volumize for, like, for example, the cheekbones. And those really last close to 2 years. But on average, they really last about a year and a half. And they work incredibly well. We don't see really allergic reactions to them because they are made of what we call hyaluronic acid. That is the main component of our own collagen. So there's really no issues with cross-reactivity, with allergic reactions. There's really nice longevity, and just patients look really good. And again, it's about really proper placement. Here's an individual where, again, she felt that she looked tired because her lower eyelids, she was hollow, and this is her afterwards. And you can see by just injecting along that crease, we can really create a beautiful, beautiful look that typically this will last about a year and a half. One of the things that I wanted to talk to you about is that there's a proper way of also injecting fillers. And typically, commonly, needles are used to inject, and I still use needles in some areas. But the problem with using needles is that there is a slightly increased risk of getting bruised, and that bruising can unfortunately last about a week. There's, again, places where a needle has to be used, but what I do generally when it comes to filler injections is I use what's called a cannula. And cannula is a blunt structure. It's shaped like a needle, but yet the tip of it is not sharp like a needle, and it's quite dull. So I am able to use a cannula by inserting it under the skin where I need to inject that filler. Because it's blunt, it cannot basically cause bruising. So the advantage of using cannulas is that we avoid bruising. We can minimize swelling. And that really has taken our practice to a level where patients don't have to worry about bruises. And especially in today's world where people are active, they're busy, you know, using cannulas really goes a long way. So I'm happy to be able to offer that to our patients. Now, in this picture, this individual has what we call kind of a nasal deformity. She has what we call a dorsal hump, which is creating this hump on the bridge of her nose. By injecting some filler up above, we can actually create a much more structured look and a better what we call a nasal strut. And therefore, really in a span of 20 minutes, we can create this look where, and therefore avoid surgery. Again, this typically lasts about a year to a year and a half. Here's another example of an individual, typically with a dorsal hump. So by injecting some fillers up above and creating basically a smoother straight line, we get rid of this curvature. Also, proper placement of a little bit on the tip can actually elevate. So a little bit right here can actually elevate the tip of the nose. Again, this is done non-surgically without resorting to any type of surgery. Now, this individual, here's someone younger who is in her late 20s. She came in wanting to have fuller lips, and she was concerned about basically her laugh lines as well. So this individual had a little bit of filler in her laugh lines. You can see the improvement, but she had just a proper amount. She felt that her upper lip on the right side did not match on the left side. And if you notice, there's a slight asymmetry where she's thinner on her upper lip on the right compared to the left. And so you can see what I basically did here is try to even out her upper lip. And my goal, my personal bias when it comes to lip injections is that less is more. I'm not a huge fan of having, creating big lips. I don't find them to be particularly natural unless the patient really wants that. For me, it's really about creating harmony and creating just enough fullness so that it looks good. So just with the proper amount, her upper lip is symmetrical with the other side, and we can create what we call like a nice rolled border so it looks more youthful. And again, lip fillers generally will last about a year, depending on the type of filler that's used. It's about making sure that they look natural. Here's another individual. It's about really enhancing not only what we call this roll, but also adding a little bit of volume to upper and lower lips. And again, my goal is to just create the most natural lips when it comes to adding volume to them. Now, on that note, there are patients who really don't want their lip touched, but they really upset about lines that emanate from their lip. And these are individuals who unfortunately have lost collagen. They don't necessarily have to be smoker, even though these are called smoker lines. This patient was not a smoker, but she had unfortunately what we call atrophy, where she had lost a lot of collagen around her mouth. And I basically utilizing a cannula, again, not using a needle, because if you inject needles into each and every one of those lines, you're going to get a lot of bruising. I was able to really, by just, basically a little insertion here, we can kind of go ahead and put this cannula and just kind of in what we call like a fanning technique, really put filler here without at all compromising the shape of her lip itself. So you can see there's a dramatic improvement. Moving on, very common areas that basically we use fillers are the laugh lines. You can see sort of deep laugh lines. You can kind of see what we call some fine lines forming. This is again from loss of collagen, some fatty tissue, and you can see the result after utilizing cannulas without really any issue with regards to bruising, bleeding, swelling. Here's an example of another patient where you can kind of see how her laugh lines were injected, her marionette lines, which are these lines that come from the corners of the mouth down here. By really filling this whole triangle here, basically, we can not only fill this area, but support the jawline better so that the jowling is improved. This is another individual who is in her late 60s, and she was bothered by really having this kind of jowling forming and the fact that she was getting these hollows in the lower part. So what I did was in this case, basically just inject here to really smooth out this area, create a better contour of her jawline. She had a little bit of filler placed in her laugh line. The goal is not to eradicate every single line, because then again, I think it wouldn't look natural given the individual's age. Another patient who wanted some subtle improvement, and you can kind of see how this jowling is better. It's not entirely gone, but she was ecstatic about that. I also did some fillers into her cheekbone here, because the real cause of this jowling has to do with the fatty tissue not only absorbing but moving down here. So by just putting a little bit of filler here, we create a better contour, we lift up the jawline, and basically we can also soften here. So we don't have to put too much filler here, even though she had some here. And then lastly, I put this picture that, you know, there are men who actually are interested in getting fillers. He's actually an individual in his 30s, but he was bothered by the fact that he didn't really have a prominent jawline. He was what we call atrophic. Sorry, let me go back. So this is an individual, by putting some fillers here, we can really create a better definition of his jawline and create a more masculine jawline. And this individual is quite happy. Again, we can get these results to last anywhere for about a year to 2 years. So that's fillers. Again, by the way, actually, one thing I forgot to mention in the beginning, please, I want to answer all your questions. It is important for me that we get to that. So at the end of the talk, there is time for Q&A, for questions and answers. So please enter your questions at the bottom of your screen or wherever you see Q&A, and we will absolutely go over all your questions. So basically that's filler. So again, there are a variety of fillers, mainly hyaluronic acid. There are fillers that are basically are not made of hyaluronic acid. I use them for, you know, basically off the body, I want to say. If somebody has what we call a lot of wrinkling on their chest, the décolletage area, if somebody wants to improve the top of their hands because they are hollow and they're beginning to see veins. Let's say if somebody is extremely hollow on their face, we can use these other types of fillers that are made of what we call polylactic acid. They're like what we call a suspension of sutures, is where like absorbable sutures that are degraded into a powder, and we mix it with water and inject. But I use that typically on the chest. In someone who's really hollow on the face, I'll use that again for people who want to have some improvement of their buttock area, and I set the hands. So there are a lot of off the face areas. That's basically fillers. That is, fillers I would say is by far the more mainstay treatment that I do non-surgically. And then now moving on to talking about lasers. Lasers are a remarkable tool for improving a variety of things, whether it's sun damage, wrinkles, brown spots, broken blood vessels, scars. And I want to just kind of go over some of that with you. Lasers have been really around since the late 60s, but over the last 30, 40 years, even longer, they have been really more perfected. There are newer generation lasers always coming out where they're able to eradicate a whole host of aging issues with really minimal downtime. And one of the more common things patients present with is using, you know, treatment of sun damage. And so what lasers do with regards to sun damage is they target the pigment in sun damaged skin cells. As we age, we can develop hyperpigmented or dark spots from either aging or sun exposure. But with lasers, we can get rid of those brown spots. And as a result, the skin tone will appear more clear, brighter, healthier. Typically, it takes roughly about a series of 3 treatments, usually spaced out a month apart. Downtime is typically 5 to 7 days of a sunburn-like sensation. And again, it depends on what we're treating. If somebody has like individual brown spots, we kind of just almost take the laser and almost like an eraser, go over an area, and the area kind of gets a little darker, and then it just sloughs off in about 5 to 7 days. Sometimes it may take 10 days, but you can easily cover that with makeup. You don't have to hide out. If you're treating brown spots all over the face, then generally you're going to have more of a sunburn-like reaction where your skin is kind of gently flaking. Again, majority of these procedures have minimal downtime. You don't have to stay home and hide out. I'll talk to you about a different procedure where we use a more aggressive laser to achieve that, and that requires you stay home. Now, just moving on to some pictures. We get a lot of patients presenting with individual brown spots. Here's a spot right on the forehead. You can kind of make out, sort of delineate the borders here. There's another one right here. There's also one right here. And we basically take the laser. We use one of my favorite lasers in the office. It's called the Pico Laser. It's called picosecond lasers, meaning the laser is firing basically at 1/1000th of a second. I mean, that is unbelievably fast. It's hard to fathom how quick that is, but as a result, it's quite gentle. And it basically, the laser targets pigment, and it basically heats up that tissue. It turns it into a tiny dry spot, and then it flakes off usually in about a week to 10 days. Sometimes one treatment may not be sufficient depending on how much pigment is in that area, so we may have to retreat an area about a month later. So it can take anywhere from 1 to 3 treatments. Here's somebody who's a little darker tone, and you can kind of see a variety of different types, sort of sun damage spots all over. And this is her with 3 treatments. This is not the result with 1, but she was ecstatic. Her skin was so much better. Now, not all lasers are safe for dark skin patients, whether we're talking about Latino, Hispanic, African American, or even Asian skin. Some of those lasers will actually can potentially make a dark spot darker. So again, our Pico Laser is safe for Asian skin. This is a very popular treatment in Asia for patients who have sunspots. And you can kind of see how basically this is a spot and it's so much better. It is still a little bit noticeable, but barely noticeable. And this, again, can take about 2 to 3 treatments. Now, there are instances where patients present with what we call melasma. This is otherwise known as mask of pregnancy. Post-pregnancy, women can get this, or sometimes just taking oral contraceptives. And we can take another laser, which is called the Fraxel Laser, and really dramatically get rid of pigment. I use Fraxel when someone has more diffuse pigmentation, and you can kind of see how with a couple of treatments, there's an improvement. Not everything is gone, but there's a nice improvement. Obviously, sun protection is key going forward, so this doesn't come back, making sure obviously you put on your sunscreen regularly and protecting the skin. Your skincare regimen is important in terms of making sure you're using a retinoid to continue to further improve this area and sort of what we call anti-hyperpigmentation treatments. Here's an individual with a lot of freckling, sun damage, and this is her with 1 treatment of Fraxel. Not everything is gone, but there's a nice improvement. Her skin is more glowing, her pores are a little better, and this is the thing that we consistently see with lasers is that not only the pigmentation improves, but the laser actually generates collagen below the skin. So as a result, there's an overall improvement. We can use it off the face. So here's sun damage on the neck, and you can kind of see how it really gets rid of a whole layer of sun damage. Here's the chest. We can make a huge improvement. These are with a series of treatments, typically about 3 treatments, again, a month apart. We can use it off the face, again, on the top of the hands. A lot of, especially women, also men too, complain about the fact that their hands is a giveaway about their age, so we can actually make things better. Now, here's somebody who, once we get rid of their pigment, if they wanted to kind of avoid having their tendons or arteries show, we can actually put some fillers in here too. Moving on beyond pigmentation, sunspots, lasers can also be used to get rid of broken blood vessels. We have a fair number of patients who unfortunately suffer from rosacea. It's a condition where their skin is super sensitive and they get flushed. There are patients who have a lot of broken capillaries, and sometimes people can, misinterpret that as a sign of other things. So patients come in here being bothered by them. And so we can basically use what are known as vascular lasers. These are lasers that target blood vessels to, zap and enclose blood vessels. And again, as lasers really are a source of light energy. They provide a gentle amount of heat. In this case, these vascular lasers target broken blood vessels, which can happen from trauma, injuries, conditions like rosacea or aging. Typically, a series of 3 to 5 treatments are needed. Treatments are tolerable. It feels like almost like a rubber band snapping against your skin. They are mildly uncomfortable, but patients really don't need topical anesthetic, and they tolerate the treatment. It takes really about 5 to 10 minutes. Typically, in these cases, when you're treating broken capillaries, the downtime is roughly about 2 days, where patients are red and a bit swollen, like a sunburn. There's no peeling here. We have patients ice. They do get some mild swelling, so ice is helpful. And again, in the same scenario, promotes collagen stimulation. So the pores get better, the skin looks better. These are examples of people with broken capillaries on the side of their nose, and you can kind of see with 1 treatment, there's a big improvement. Here's an individual with rosacea. This is what we call end-stage rosacea. From repeated episodes of being flushed, she's left with, unfortunately, a lot of blood vessels, and you can kind of see her afterwards where her skin is better. Another case of rosacea, end-stage rosacea in a gentleman who was bothered by all these broken blood vessels on his cheeks, nose, and chin, and there's a nice improvement with one treatment. So we can really make a dramatic change with broken blood vessels quickly. Moving on to lasers for wrinkles. Now we can treat wrinkles sometimes with fillers, but there are instances where patients just develop crepey skin and they have a lot of wrinkles all over their face. And that's when lasers are really beneficial. And the mainstay laser is called the carbon dioxide laser, otherwise known as CO2. So using the power of CO2, the outermost layer of the skin is gently removed. So in this case, we actually remove a thin layer of skin. We try to go down to a depth where there are no wrinkles. It's hard to kind of go that deep. That's why not every line goes away, but we can make a dramatic change. It's really ideal for patients who have severe crepiness and deep set wrinkles. And this particular laser can actually take years off a person's face in a matter of really minutes. It's really a 30-minute procedure. In this case, we do need to provide not only topical anesthetic, but we do inject some anesthetic into a variety of areas on the face. So we numb the patient. It can be done under what we call IV sedation. Not necessary. Majority of the patients we treat are really a combination of topical anesthetic plus injections. In this case, there is downtime where for about truly 7 to 10 days, you need to stay home because you do have scabs and a layer of skin is removed, but it makes dramatic change. I'll show you some examples. Here's an individual on your left where you can kind of see a variety of, a lot of lines above the eyebrows and the forehead, the crow's feet. You can kind of unfortunately see the crepiness to the skin, but this is her a month out. And you can kind of see how not every line is gone, but there's a nice improvement. Basically, by removing a thin layer, we create new skin. The new skin has thicker collagen layer. Here's another individual who basically was bothered by the severity of this crepiness, deep lines, and basically I lasered her whole face, and you can kind of see how her skin is just all brand new skin, even to the point where we can actually really improve a lot of these lines that go into her eyebrow. I was able to, by lasering her upper eyelid and her lower eyelid, so we go really close to the lashes, we can actually tighten the skin. Here's an individual that not only has sunspots, but she also has lines, and she was bothered by it. And by lasering her with the CO2 laser, it's actually a laser that our machine is called Fraxel Repair. There are a variety of CO2 lasers out there. Fraxel Repair happens to be really one of the more sort of third, fourth generation lasers, because the older lasers tend to cause whitening of the skin because they were too harsh. The newer lasers are able to basically create a treatment where the pigmentation of the skin is not affected, meaning the skin doesn't get lighter in color. And you can see how her brown spots are significantly better. Her overall skin complexion is better. Not every line went away, but certainly there's a nice improvement. Here's another individual with that crepiness and how just the skin is just better. Another person who had some brown spots, a lot of wrinkling, and her skin is just a lot tighter. And therefore, she was just a lot happier with it. Finally, lasers for scars. We get a variety of patients who unfortunately have scars, whether it be from surgery, whether it's from trauma, whether it's acne scars. There are different lasers that use a different energy to treat certain aspects of scars. Sometimes scars are red, meaning they have a lot of blood vessels in them. And in those situations, we use vascular lasers to treat red scars. Those are more fresh scars. We can actually use the CO2 laser that I just showed you examples of to treat thickened scars. We can actually use a CO2 laser to treat acne scars. There's milder versions of lasers such as Fraxel that can really treat acne scars. Generally, scars need about 4 to 6 treatments a month apart to really see a nice difference. This is an example of a fresh scar that's red. It has a lot of blood vessels in it, and by kind of lasering it, we can not only get rid of the broken capillaries and therefore the redness, but we can actually also flatten the scar. This is typically with about 5 treatments. Here's somebody who had thyroid surgery, unfortunately was left with this scar going in the lower part of her neck. And this is with a series of about 5 treatments, and we can really get rid of the redness. We can diminish the elevated aspect of the scar. Sometimes lasers will require some cortisone shots as well to really be aggressive and flatten the scar. This is surgery from, this is scar as a result of removing a growth, a mole, and this individual, this gentleman was left with the scar he was unhappy with, and we came with a series of CO2 lasers, kind of really create this kind of look, which is significantly better. Here's another example of a raised fresh scar. So we use a laser to treat the blood vessel component. We also inject and also use the Fraxel laser to flatten it. So that was, I was trying to, in a matter of half hour, 40 minutes, go over the talk with you. And so I appreciate so much your presence here. I appreciate that you joined. I'm excited to really provide that information to you. We're here to help you. Certainly, if you have any questions, you can feel free to call us. You can follow us on social media if you're interested. There's also the email address here. Feel free to email us with any of your questions. Really, my mission and my staff's mission is to truly serve you in the best possible way, to give you all the help you need to look your best. And just on a final note, before we get into Q&A, I really hope that everyone's being resilient. Our country is going through such difficulties in so many ways, and we will come through this. And it all requires, I truly believe, love and unity, and just being kind to each other and have empathy and listening to each other. So with that said, I'll hand this over to Jasmine, who works in the office. Jasmine is just going to basically start asking me your questions, and I'm hoping to get through all of them. So with that said, let me just kind of end the stop share thing. And okay, I hope you can see me. So Jasmine, go ahead, please.
Yes,
ask me the question.
Thank you so much. Thank you so much. I hope everyone enjoyed the webinar. I do have some great questions here that I'd love to share with Dr. Ostad so we can get them answered. So we have a question. When would you suggest someone to start Botox?
So that's a great question that comes up. There's really some controversy on that. I believe that you should really get Botox when you begin to see lines. Now, there's a camp out there of physicians who say you should be preventive and maybe get Botox earlier in your 20s. I come from a philosophy of less is more. So I think you should really get Botox when you're beginning that upon expression. So meaning when you are really, for example, frowning and you're beginning to see some frown lines, or when you're smiling and you're beginning to see some crow's feet, or when you're expressive and you're beginning to see some forehead creases, that's when you should do Botox. If you wait too long where those lines get etched in, Botox is quite not going to work. And that there's still things you can do like fillers, which are just as good, which are fine. Ironically, they last longer. But I don't believe that you should get Botox when you look great and you're in your 20s and early 30s and you don't have any lines. I feel like it's a waste. It's sort of a waste of money, and I don't think it's going to serve you. It's not going to necessarily postpone those lines from coming out years later. So I certainly don't want you to feel anxious that you have to do those things, but really when you begin to see some signs of lines.
Awesome, thank you. Next question we have is, do we still do Ultherapy?
Beautiful. I actually didn't talk about that, and maybe I should have actually mentioned that. But so let me talk to you about what Ultherapy is. So one of the common things that we experience with aging is we get jowling, and we get this heaviness, and that's because we've lost, fatty tissue and collagen up here, and there's this shift where heaviness forms here. So certainly one of the common ways to improve that is with just some fillers in our cheekbone to lift up the cheeks. But there's another technique which is called Ultherapy. It's actually using ultrasound. Ultrasound, as we all know, is used for therapeutic applications, is used actually for diagnostic applications, for when a woman is going through pregnancy to visualize the baby, or certainly for looking at the internal organs. But ultrasound can actually, unlike lasers, generate heat much deeper. Lasers really treat the surface of the skin, but Ultherapy with ultrasound, you can generate heat very deep near the muscle layer, and that heat contracts tissue and sets in motion collagen production. So over a course of 4 to 6 months, you get this sort of tightening of the skin because new collagen is formed. So in someone who I would say truly is like 50s and older, and you're beginning to see heaviness here, I would recommend combining Ultherapy with fillers up here, because you can really tighten this so nicely with Ultherapy. Ultherapy lasts for about a couple of years. It is a procedure we do in the office, but in an ideal situation for people with heavy jowling, I would incorporate Ultherapy with fillers.
That's awesome. Thank you, Dr. Ostad. So another question we have is, are facelifts the only long-term solution for the sagging skin under the chin and the neck? And what is the least traumatic procedure for that area? This person was 57 years old and she was curious.
Great question. So, you know, facelifts, there are times where just facelift is necessary. I view facelifts as necessary where truly as a generalization, it's hard to put a number on it, but I would say really someone who's their like mid 60s and older, where they have such severe loose skin, and that is like in their jawline, their neck, where no amount of filler or therapy is going to really do the job. So there's a time and place for facelift, but it's really the last option. One of the issues I have with facelifts are wonderful when they're done properly, where the person is not too pulled back, so they don't have this windswept look. Like I said, when done properly, there's a great time and place for it, but I think there's a lot one can do to avoid a facelift. One of the big misconceptions with aging is that just the skin gets lax, but you know, there's really, aging has to do with the support structures underneath being diminished that causes our skin to fall. So if you can early on in your 40s, 50s, begin by doing some fillers, fillers really help support not only your cheeks, your jawline, but fillers, one of the things I forgot to mention is that fillers actually stimulate collagen. When you inject these fillers into the face, your own collagen forms around them. So even though the fillers are gone, let's say a year and a half, 2 years later, you still have your collagen layer there. So if you start out early with some fillers or Botox for the upper part of the face, you can push back the need for facelifts. I mean, ever since fillers have come around over the last 10, 20 years, the number of facelifts that are being performed has dramatically gone down because you can postpone the need for a facelift. So I think, ironically, fillers really address the real cause of aging so much better than facelifts, because you can get a facelift and tighten your face, but yet you still kind of hollow in your cheekbones. You still have these fine lines. You still have a prominent laugh line, which a facelift doesn't address. So you still have to get some fillers to create a proper, adequate face that's filled.
Thank you, Dr. Ostad. Next question is there aftercare for facial eye fillers?
So typically with any filler, there's really no aftercare that's specific. Like in this case for under eye filler, unfortunately the under eyes are sensitive areas. So I use a cannula there so that I avoid bruising. But no matter what, you are going to get some swelling there, and the swelling generally can take sometimes a day or two. Sometimes, unfortunately, it can take longer than that. But the aftercare is really some ice. We have you ice ahead of time. We have you ice right after. I recommend you ice for a day or two, maybe like 2-3 times a day to help reduce swelling. But there's no particular aftercare with regards to injections under the eyes. But you know, your skincare regimen is important. It's important to ideally utilize some form of retinol or retinoid to help with some crepiness under the eyes. It's I think nice to use some antioxidants, certainly moisturizer, but nothing in particular specific for a filler injection.
Okay, great. So the question was, what is the sensation of using the fillers? And is the patient aware of a foreign substance underneath the skin? And then just adding to that, they wanted to know also, does it contribute to that quote unquote frozen face look?
Sure. Great questions. So what do fillers really feel like when you're injecting them? They don't, you can't really feel them. You may kind of hear something. You may sometimes patients say, well, I kind of hear a little bit of crunching when kind of the cannula is going in, but you don't really feel them. You do immediately feel a sensation of numbness because there's a little bit of anesthetic in the filler. So you do get a little bit of numb in that area for about an hour, but nothing long term and nothing certainly when it's being injected. With regards to that frozen look, the frozen look can happens with Botox because the Botox is relaxing your muscles. So you're not going to get that frozen look with fillers. And the frozen look can happen if too much Botox is injected. So fillers really primarily just kind of soften deep lines. They kind of add some fullness to your cheeks. They lift up your jawline. So there's nothing frozen about that. And I don't know if I answered the other parts of your question. So it doesn't really feel weird. You don't feel like there's any. Now, in terms of feeling something is there, so that is an important thing. I think there's a proper placement of these fillers. Sometimes fillers have to go right underneath a sort of a very superficial fine line, but when you put the right amount, you're not going to feel it. Some areas the filler has to go deep and you won't feel that. But sometimes if you put the filler a little too superficial, when you touch it, you may feel a little firmness. You may feel that for like generally a week afterwards, but that goes away. But you should not be feeling the filler. And if you do, in maybe a rare case, maybe truly 1 to 2% may feel that, but it's ultimately nothing that's protruding, nothing that shows up as a bump. You may touch an area and feel it, but in majority of patients, it goes away in a week or two, if it happens.
Great, thank you. So the question we have is, what can tighten crepey arms?
So great question. Great question. That's a challenging that's a challenging condition. I have treated that in the office numerous times. So crepey arms have to do with, unfortunately, long-term sun exposure. You've lost collagen in the skin, so the skin is really atrophic and thin, and it kind of becomes crepey. And so the way I treat that, I combine different modalities. And what I do is I use Ultherapy. I use Ultherapy to stimulate collagen. We can use Ultherapy off the face, especially I can use it on the chest. I can use it post-pregnancy for stretch marks, wrinkling, crepiness on the abdomen. So we can also use it for the crepiness on the arms. So I'll do some Ultherapy to stimulate collagen and improve the contour and the thickness of the skin. But I also inject fillers there. So one of the things, if you remember, I mentioned that there are other products like suture suspension products where they're in the powder form, and we inject them diffusely into an arm, and we can actually thicken the skin. Now, there are patients that the reason they have kind of sagging arms, it's because they have this genetic condition where their skin is kind of loose because they have fatty tissue, and the fatty tissue weighs down on the skin. And in those cases, a simple treatment is really suctioning that fat out. So we do liposuction under local anesthesia, and by just removing that weight that's really made up of fat, the skin bounces up. But if somebody really has crepiness, you have to utilize different modalities, whether it's microneedling, whether it's Ultherapy or fillers. There are other treatments, by the way, I didn't mention to you that we do in the office. I was trying to sort of stick to the main treatments we do, but there's microneedling that can be great for scars, for improving skin texture. There are facials we do in the office, which is made up of what we call PRP, platelet-rich plasma, where we take your own blood, spin it down, take the plasma, the clear component, which is made up of growth factors, and just kind of inject it with little microneedling devices that really creates this glossy, glassy look. So depending on the condition, there are certainly a lot of non-surgical treatment options.
Awesome, thank you, Dr. Ostad. We have a question, do we use Morpheus 8? And if you could explain that procedure.
Absolutely. So Morpheus 8 is really a trendy procedure right now. It's basically utilizing microneedling along with radio frequency. So it's just basically one of a company that has their device, sort of they're new to the market. They've been around for over a year. And basically what it is, it's a device that delivers tiny needles into your skin, and it's coated with basically a coating that also delivers heat in addition to the needles. You know, one of the challenges with doing this kind of work is that there's a lot of marketing out there, and then sort of it becomes very challenging for patients to sort of know hype from sort of fact. And certainly Morpheus 8 works, but there's nothing necessarily magical about it compared to other treatment options that are out there. We basically provide a treatment. It's not Morpheus 8. I've been basically helping patients with utilizing our radio frequency microneedling device. It's called EndyMed. It's been, we've had that machine for over 3 years. I'll use it basically to treat sagging skin, maybe on the abdomen, on the, certainly the face for like acne scars, someone who has kind of more like crepiness to the skin and doesn't want to go through a CO2 laser, doesn't want to go through that recovery of 7 to 10 days of staying home, where they're happy to get sort of gradual improvement over 3 to 5 treatments. But certainly Morpheus 8 is a good treatment. It's just another basically toy that someone can have in terms of offering that to the office and maybe staying up with the current, with the trends. But it's certainly, the technology of it is microneedling with radio frequency.
Thank you. Somebody asked about halo laser treatment.
Yeah, so halo, ironically, it's along the same sort of conversation we were just having. So halo is basically fractionated technology by a company called Cyton. So, you know, the sort of big treatment that's been around for a decade now, it's what we call Fraxel. Fraxel is a laser that's used for treating hyperpigmentation. It's used to get rid of acne scars. It's used to improve skin texture. And basically what it is that as opposed to like providing this energy with the laser in every aspect of your skin, the treatment is fractionated, almost like pixels on a TV screen. So you kind of get this sort of pinpoint spots that are dispersed with normal skin. So not every part of the skin is treated. And that is kind of the big name on the market, is because it's been around. It's one of the sort of workhorse lasers in my practice. Halo is basically the same technology made by a different company. That is all that it is, by another laser company called Cyton. So, but yet it accomplishes something very similar to Fraxel. So it's a great treatment, nothing wrong with it, but there's nothing necessarily superior to it compared to the other treatment, other lasers that offer the same technology of fractionated. Basically what they do is they, as I was mentioning to you, we can avoid like discolorations of your skin where too much laser energy is put in. So the recovery is faster. There's less chance of like hypopigmentation where the skin can get lighter. Just faster recovery and more gentle laser, which is very similar to exactly what Fraxel does.
Thank you, perfect. Question was, do you think, as far as fillers, do you think they're better than the threading?
That's another great question. So again, these are beautiful questions. So threading is really another trend in the field. And when threading, and we're talking about, and I want to make sure people who are listening understand or watching understand, is that basically there are threads that you can insert under the skin and use them to get rid of lines or to lift up the jawline. I was so excited about that technology about 2 years ago when it became available, and we started using it on our patients before, actually using it on individuals before offering it to patients. Because I haven't been doing this over 20 years, I'm a bit of a skeptic when it comes to new technology. I want to make sure that, you know, again, we want to separate fact from fiction. And my experience with basically using these lifting threads is that, you know, the results were not necessarily, longer than fillers. If anything, there were kind of issues. There were potentially where the thread would poke its, head out like a week, 2 weeks later, or a month later. Or sometimes it would get absorbed like in a few months, and it wasn't necessarily lasting longer than fillers. And then there was issues where it was creating sometimes asymmetry, where one thread was holding in place, but yet the other thread would loosen up and then the skin would fall. So it would create this issue with unevenness. So there was extrusion of the material, meaning coming out. There was that it wasn't more long lasting, and if anything was creating asymmetry. So I stopped offering it. Now, maybe down the line, the technology will improve and there are better threads that can really hold on to the undersurface of your skin. But at the present time, I just basically stick to fillers. They're safer. They work just as good as threading, whether if you want to lift up the eyebrow, elevate the cheek. So I am not a fan of using lifting threads. Now, people can say other things, but this is the issue with, unfortunately, this field is you have to do your research.
Perfect. Thank you so much. So we're being asked, is there any significant benefit to doing the fat transfer as opposed to fillers?
Beautiful.
And that's transfer more complicated or challenging in terms of process and recovery?
Sure. That's an amazing question. So I love fat transfer. So fat transfer is where basically you take fat from one area of your body and basically inject it into the face. The nice thing about using your own fat is that you have an unlimited source of it. So it becomes, in my hands, really beneficial to do fat transfer over fillers when there's a lot of areas to inject. So if someone is really hollow on their cheeks, they have prominent laugh lines, they have prominent marionette lines, they have some sort of hollowness under the eye. So sometimes that individual can really need like 8, 10, 20 syringes over time to make them look properly filled in without overdoing it. Now that you run into an issue where unfortunately it becomes cost prohibitive. And so that's a case where fat injections are beautiful because not only is your own fat, we have an unlimited source of it. We can basically easily kind of go ahead and take the fat. It's an easy process. We do it under local anesthesia. It's actually not difficult. We do it under local anesthesia. We numb an area, let's say on the outside aspect of the hip, suction out the fat that we need. We purify it, put it into little tiny syringes, just like a filler. And we can easily go about and do like 8, 10, 15, sometimes 20, 25 syringes. So, and fat injections last. They don't last forever, but they definitely last for a few years. They last longer than conventional fillers. So I love them. Again, we run into an issue where there's, I think, unfortunately, some marketing where you can get some offices or more importantly, maybe companies that make the fillers promote this stuff, but fat is tried and true. That's what I used to do in the beginning a lot of. One of the things I love about fillers is that, you know, we don't have to go through the process of numbing an area from your hip, taking the fat out, injecting it. Fillers are already pre-made, pre-filled syringes. We can go ahead and inject them. They're easy. We don't have to numb your face like we need to for fat injections. So there's really an advantage to fillers too, especially if you have small areas that need to be filled. I would still say fillers are the best to do for that. If you needed a lot of areas, it makes more sense to use your own fat.
Great, thank you. We have time for maybe one more question. What is the one thing that you should avoid before getting fillers?
So I interpret that in different ways, but let me go over what my thought process is. So one thing you should avoid immediately right before a filler is really avoiding anything that makes you prone to bruising. And there are a variety of things that we encounter in our daily life that can promote bruising. So one of the more common things is wine, alcohol. So we all love our wine, but you know, we have to make sure for 2 days before you stay away from any wine or alcohol. That thins your blood, makes you more prone at risk for bruising. Along that same concept, there are things that thin the blood like supplements like vitamin E, vitamin C, fish oil. You want to avoid those for a week. Certainly baby aspirin, certain herbal remedies like ginkgo, garlic. There's a sheet that we give patients, and this way we can really minimize any chance of bruising. There are also like vitamin supplements like omega-3s, fish oil, flaxseed oil. Those really make our blood thin. So we avoid those for a week. That's immediately. But in terms of what you should avoid, you know, long term so that you can minimize the need for fillers, I would, we're getting into a big topic, but I would certainly say your skincare regimen matters. So obviously wearing sunscreen, protecting yourself from the sun, taking care of yourself, moisturizing your skin. Moisturizing is critical for your collagen layer, wearing your sunscreen, avoid irritating your face with too much face washing, with soap, with cleansers. Using your skincare regimen matters, as we talk, like using moisturizer, retinoid, sort of an antioxidant that has like vitamin C, vitamin E, green tea, like polyphenols. And then I think your lifestyle. So, your lifestyle is like exercising, getting adequate sleep, your emotions, like, being in a positive state, which is challenging to do given, our life right now, meditating, all those things, living like a good, taking care of yourself, exercising self-care, that really makes you stay younger. So all of those things, I believe in that so much. Meditating, all of that.
That's wonderful. Thank you so much, Dr. Ostad. That ends our Q&A.
It's my pleasure to be here with you. Thank you for joining. And I really hope we see you in the office at some point. We're here for you and we're happy to help you with any questions you have. So be well, stay well. I think Jasmine wanted to share something with you that she just got a word of a couple of days ago from, we basically work with a company called Allergan in terms of getting our products, but I think there's something that they sent to her. You want to share that with the group?
Absolutely. Along with an email that's going to give you access to this webinar so you can refer back to it whenever you like. Allergan is offering a short-term promotion for patients who are looking to have some Botox and filler. So if you want to participate, once you get that email, you just give the office a call and we can help you get that process going.
Yeah, and I think it was mainly like some promotion in terms of, I think, reduced pricing for them. So
yes, it's a discounted promo that they have, and they definitely should take advantage of.
And that's available to whoever is interested. This is something really not put out by us, but it's by the company that trying to, obviously, hopefully, given the challenging economic times, that's something that's available. Anyway, I truly love all of you guys. I appreciate so much for being in on this webinar, and be well, and see you soon.
Thanks so much, Dr. Ostad. Everyone take care of yourself.
Thank you so much. Take care.
Bye-bye.